So with Botox, the nice thing is it's a very minor procedure, very tiny needles would put in the muscles of the jaw, and it can relax people that have clenching or grinding. Also, migraine treatment. That's where dentistry started, with treating clenching, grinding, and migraines with Botox, and it's pretty amazing.
Well, and I heard you're also doing Botox. Now, tell me, what does Botox have to do with a dentist? Why does a dentist administer Botox? What would be the advantage there, for a patient, or is it just it's a one shop saying, Tell us about Botox, what you do, why you do it, how you got into it,
Yeah.
and why is
So
it?"
So dentists have been prescribing Botox or having Botox done for their patients um, for many years on clenching or TMJ patients. So they found that surgery sometimes is great for patients for their TMJ and clenching. Sometimes it doesn't work out. It's not 100% success rate. So with Botox, the nice thing is it's a very minor procedure, very tiny needles would put in the muscles of the jaw, and it can relax people that have clenching or grinding. Also, migraine treatment. That's where dentistry started, with treating clenching, grinding, and migraines with Botox, and it's pretty amazing. Patients will feel the results. The best results are about 2 weeks after we do the injections, but they'll have great relief for 6 months. They need to update an addition of Botox after every 6 months, but it's like getting your teeth cleaned. You get your teeth cleaned every 6 months. I have patients that they know exactly when their Botox wears off. They're like, "Oh, I started clenching again or grinding again. I had a great result from the relaxation, but now I'm clenching or grinding again." So yeah, that was where dentistry first got involved. Now we work in the mouth too. We want people's smile to look beautiful. Uh, and we found some people have real thin lips. Their upper lip would be really thin, and we do these beautiful veneers, but we wanted to give them a little bit more lip. There is a Botox treatment, what's called the lip flip, where you give just a little bit of Botox and it can tip the lip out, so you have a prettier lip, or a nicer looking lip, and that would enhance the final smile. We're smile doctors. We work on smiles every day, and so if we can do a little Botox to help people smile look better, or sometimes relieve minor wrinkles in the face, then I'm happy to provide that service.
Wow. So basically, as you said, you're a smile doctor. So, a dentist really is, there's this enormous technical fact about teeth. Everything is extremely precise. It's down to literally a fraction of millimeters in almost all cases when you do veneers and crowns and whatever it is you do, and implants. Um, and at the same token, there's lots of artistry to make it look uh, nice and fitting to that person. It's almost like a fashion designer. Not every color,
Yeah.
not every style fits every person. You know what I'm saying?
Yeah.
And
Yeah.
goes it with a smile. But from what I'm getting, tell me if if understood this right or wrong. So this whole thing started. You said DMJ. Basically, what that is your jaws, your hinges in the back. Somehow they are misaligned. Something doesn't quite work, and it can maybe because you're grinding, or it makes you grinding, things then a little bit crooked. And yes, you may get headaches and all kinds of things, even neck pain and shoulder pain, I have heard. And so by you with Botox, you actually relax the muscles enough so that then they can normal function. This cramming up of the muscles is gone, so to say, or is overshadowed. Whatever, doesn't really matter as long as it works. We usually don't care what it is, but, uh,
Yeah.
And so
Yeah, I tell patients it decreases the power of their clenching. So they can still chew, they can talk, they can eat even after they've had the Botox. But what it does, it decreases the power of the clenching by 50%. No, none of the patients have ever complained of any problems eating anything. So you can still eat and chew, and but it decreases that full power, grinding and clenching where some people have broken teeth from clenching or grinding. So if we can provide some treatment, even with Botox that prevents people from breaking their teeth, I'm happy to provide that service.
yeah, no, I can see that. I mean, if you clench your teeth, it's like try it with a fist. Eventually, it starts hurting. You clench your teeth. I can totally see why people have headaches and neck pain and just feel uncomfortable. So it would be good for everybody except maybe those few people who try to open their beer bottle with their teeth, right? I mean, they maybe
Yeah,
they should have more power. Maybe you shouldn't give them Botox, but those
yeah,
few in between. And then there is the beauty a little bit also. Are you doing also, since the guy's already there, you're doing Botox and you said small wrinkles. So if the lady um wants to a little bit, the eyelid and is that part of it then? Or like you say, no, I don't go so high. That's not what I do. I stay around.
yeah. We stick mostly around the mouth, and if they're getting migraines or problems from uh, clenching or grinding, we do some forehead, which is called the frontalis, and then also the glabellar. We find the glabellar is involved in headaches and migraines, so we can treat that, and that also treats it cosmetically because you don't get they call them the 11s. I keep mine just so I can explain to patients what happens.
Yeah, no, wonderful.